Okay. Welcome, everyone. Thank you so much for joining us for this informational session on the Global One Health Fellows Program offered by the NC State Global One Health Academy. My name is Meredith Spence Beaulieu, and I am the Program Manager of the Global One Health Academy, and I co-lead the Global One Health Fellows Program with Michael Reiskind. I'll let Michael introduce himself.
Hi, everybody. I'm Michael Reiskind. I'm an associate professor in the Department of Entomology and Plant Pathology, and I'm also the graduate program director for the Global One Health Academy. And along with Meredith, we run the Global One Health Fellows as well. And so we're going to take some turns in describing this program to you over the next 15 to 20 minutes, and then there should be plenty of time for question and answer about the fellowship program. Meredith, back to you.
Yep, wonderful. Thanks so much. So I wanted to start, first of all, by talking about briefly kind of what is One Health. We are the One Health Academy, and this is the One Health Fellows. So I want to make sure we all understand what we mean when we say One Health. So this is a definition from the One Health High-Level Expert Panel, which is a group of experts that got together to really define what is One Health in the last year or so. So they define One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems, which are closely linked and interdependent. This is not a perfect definition for a few reasons, but it does really highlight kind of the key thing that it is the intersection of different health domains, including humans, other organisms, and the environment. And these health systems are interconnected, and in order to improve the health of one, we have to consider how it relates to the health of these other systems and ideally aim to improve them all simultaneously. So that at its foundation is what One Health is, and that's what we mean when we say One Health. One Health is a really important concept, and it's been gaining in popularity, and people have become more aware of it, especially after the COVID-19 pandemic. As our population grows, we're coming into more contact with animals. The way we use land is changing through development and use of natural resources. We're living closer together. The climate is changing. All of these things make it easier for diseases to spread between animals and people. So this is the emphasis of kind of the CDC and how they approach One Health. We at the One Health Academy, Global One Health Academy, don't limit to infectious diseases. We have other research interests as well. But again, at our core, we're interested in the intersection of human, animal, plant, and environmental health. And so I really like the CDC definition because it does emphasize plants as an important part of this One Health environment. So the Global One Health Academy's mission is to engage with faculty, staff, undergraduate, and graduate students in improving the health of plants, animals, biodiversity, and human society in North Carolina and beyond. Again, I want to emphasize that we take a broad view of One Health. We are not just human and animals and the environment. We specifically call out plants as an important piece of that, and also biodiversity. So thinking about how that affects health of all these different components of human and animal health as well. So that's a little bit about the Global One Health Academy, what our mission is and what One Health is. And so I'll let Michael talk about what the Global One Health Fellows Program is.
Thank you, Meredith. So the Global One Health Academy was established in 2022, fall of 2022, and one of the initial approaches we took to bringing about study in Global One Health at North Carolina State University was to establish a fellows program. And so right away, we began the process of developing what that would look like, and had our first competition for fellows last spring, about this time last spring. We had 83 applications for this cohort, this first cohort of fellows, of which we actually selected 6. One was unable in the end to take the fellowship because of various visa and travel issues. But we were able to recruit 5 Global One Health Fellows out of those 83. And one thing that should tell you as perspective applicants to this program is it's highly competitive. We're talking about a funding rate significantly less than 10%. And as such, we end up with incredibly talented fellows. This first cohort is true, and we expect it from this next cohort as well that you'll be applying to be part of. Here are our 5 fellows from that initial year. One thing I want you to know is the diversity of programs from which these fellows come from. We do have 2 from the College of Engineering. Those engineers are great, but we also have a student from Natural Resources. We have a student from Humanities and Social Sciences, as well as one from Genetics and Genomics. So it really encompasses the whole campus. And we love our applicants from these diverse disciplinary backgrounds. One other thing to note is hold on, Meredith, is we have funded one international student. Actually, the student that wasn't able to come was also an international student. And, not all fellowships are eligible for international students, but the Global One Health Fellow is one that all students either at NC State already or who have been accepted to a graduate program at NC State are eligible to apply for this fellowship. um, yeah, the fellowship will be similar to last year's, with the exception of the stipend has gone up. So that should make everybody happy who's applying this year, as well as we have certain expectations about what the fellows will do over the next year that has changed slightly from the first cohort. Go ahead, I think.
Yeah, so as Michael mentioned, we do have some expectations of the fellows, which has changed very slightly since last year's application. But for this year's applicants and for people that are joining us as fellows for the 2024 to 2025 academic year, these are going to be the activities that we have for the fellows. We have 2 courses that we'll be asking you to take, which Michael will talk a little more about. There's a 2 credit hour One Health from Philosophy to Practice course and a 1 credit hour Global One Health seminar course. We have monthly professional development meetings. These are hosted jointly with other interdisciplinary training programs on campus. So this is a great way to network with lots of students that are beyond your discipline and across the campus. We have a research symposium that you'll have the opportunity to present at. We also would like to provide interdisciplinary co-mentorship opportunities to help expand your research. And we'll have some mixers for the fellows and for their advisors. So we'll talk a little bit more about what each of these things are.
Thanks, Meredith. So I take an active role. In fact, I am the instructor of record for both of these courses. And so I can tell you a lot about them. In fact, I could probably spend an hour talking about these courses because they're both integral to the training of the Global One Health Fellows, as well as just fascinating courses in and of themselves. The first one is a 2 credit hour course called One Health from Philosophy to Practice. It's currently housed in the vet school, but it is open to everybody, and our fellows are required to take this. This is perhaps the most interesting course in the Triangle because it is the only course that is cross-listed jointly at UNC Chapel Hill as well as at Duke University. So public and private universities and the flagship university of the UNC system, as well as the land-grant university of the system, land-grant university of the UNC system. That's us. And this really, speaks to the importance of One Health as a framework for understanding health in general, and draws on really all of the resources in the Triangle. It's a really interesting course. We meet at a kind of common location, and we bring in speakers from all over the country that are leaders in One Health and One Health related fields. A fascinating course and really enjoyable, and will really broaden everybody's perspective. Now, one thing that we join with that is this 1 credit hour Global One Health seminar course. And this is a real opportunity for the fellows, although it is open to other students as well, but it is an opportunity for the fellows to really bond and communicate with one another and form a cohort that is going to work together in thinking about how to broaden beyond one's disciplinary focus on on health maybe or health related into a kind of one health framework that can draw on a number of different disciplines. This course is one that I think we learned a lot in the first year in a good way. I think it was a really good course in the first year, but I think we'll also improve it going forward in terms of having it lead to something that is actionable and product oriented as well. All right, Meredith, you can.
Great, thank you. So the monthly professional development meetings, like I mentioned, these are hosted jointly with other interdisciplinary programs on campus, namely the Genetics and Genomics Academy, which has a scholars program for graduate students, the Genetic Engineering and Society Center, which helped lead a traineeship program called Ag Biofuse. It was an interdisciplinary program. We piloted it last semester. We have a diversity of topics, including kind of more soft skills like expanding your networks and having good work-life balance, but then also more, I guess, hard skills or science skills like how to use ORCID effectively, how to do effective literature searches. We do have this series for the spring as well, and we're pleased to say it's now open to all graduate students, not just limited to the fellows of these programs, although we do require our fellows to participate. So if any of these are of interest for this semester, we also highly encourage you to attend. There's one next Friday, the 19th. We're going to have two research librarians talking about systematic literature searches and best practices for citation and data management. So that's going to be a really great session for early stage and later stage graduate students. And I'll put a link in the chat for a registration form you can fill out. Registration is not strictly required, but just helps us in planning. So I'll put a link there in the chat momentarily. The last things that we expect or offer to the fellows, we have a research symposium that we ask that all of our fellows present at. We'll be doing this for the first time this semester, so we're still figuring out exactly what that will look like. But this semester, we're going to be hosting it jointly with the other two academies on campus, the Genetics and Genomics Academy and the Data Science Academy. So we're really excited about that. Really interdisciplinary symposium and a great opportunity to show off the fantastic graduate research happening through these academies. We do also want to offer interdisciplinary co-mentorship opportunities. We're still figuring out the best way to do that, but the Academy did launch our affiliate faculty program where we have a group now of, I think, well over 150 faculty, both from inside NC State and externally, that do really exciting One Health research in all of our different thematic areas. And the goal here is that we can learn more about your research, what you're working on, and figure out if there are ways that we could bring in different perspectives that would expand the breadth of your research and make it a more interdisciplinary One Health research project. And so we kind of want to play matchmaker there for people that are interested in taking advantage of that opportunity. Michael, is there something else you wanted to add there?
No, but I thought maybe I would tackle the fall and spring mixers.
Sure, yeah, go for it.
So this is something that we haven't really done this first year, but we realized is important for the next cohort, which is having essentially social events, but professional social events in which we engage the advisors of our fellows in addition to the fellows. And my role in the Global One Health Academy is the graduate program director, but my role in my department is the director of graduate programs, the DGP, which if you're at NC State should be a familiar term to you. And one thing that I've learned as DGP is that relationship between between graduate student and advisor is the most important relationship in graduate training. And we want to directly engage that relationship that, in this Global One Health fellowship, as well as give an opportunity for us to get to know the advisors to get to know one another, and hopefully this will lead to more of these interdisciplinary co-mentorship opportunities by really engaging the faculty in addition to the students themselves. And so in order to do that, we're going to plan both fall and spring mixers that would be light and social and kind of fun things, just to try to get the conversations going between fellows and their advisors about One Health, but also between the various advisors in the One Health context, and maybe between not their students, but other fellows and advisors as well. And we'll also probably invite more broadly faculty from across campus, affiliate faculty. Yeah, so I did want
Yep,
to say that.
wonderful. So moving on to what the application is. So first, eligibility. Any current or incoming NC State graduate student from any academic background is eligible to apply as long as you have One Health related research that aligns with one of our thematic areas. We do define research broadly. It doesn't have to be like hard science research. We also very much encourage social science research, educational research, research on communications, just as long as there is a research component of some sort that is relevant to that One Health framework. So really at the intersection of human, animal, plant, and environmental health, and aligns with one or more of our thematic areas. Our thematic areas are food and water solutions. So this can range from improving food insecurity through plant health to water sanitation and hygiene, and thinking about water quality and things like that. Infectious diseases is another one. This can be directly transmitted infectious diseases. This can be those that are spread through vectors. Climate change and health disparities. So this is really any climate or global land use change. And then we also are interested in how those things might differentially affect different populations. So that's the health disparities portion. So again, any student at NC State or accepted to and coming into NC State from any academic background, as long as you have One Health research that can fit into one of these three categories, is very much encouraged to apply. The application itself is a research statement, which is 2 pages max, 12-point font. Here you really have the opportunity to tell us what your research is about. What we really look for here is that it is written so that it's broad enough that anybody from very diverse backgrounds can understand what you're doing and why it's important, because our reviewers are faculty that run the gamut of programs at NC State. So you might have an engineer reviewing your proposal, you might have a social scientist, you might have a humanist. So you have to write it in a way that it's accessible and compelling to that broad group. And then there's specifically a section for you to explain how your research aligns with the One Health framework and with a Global One Health Academy thematic area. So this is an opportunity to really show how your work is in that intersection. The second piece of the application is a personal statement. This is 1 page max, 12-point font. This is an opportunity for you to tell us why you want to be a part of this program in particular, and why you want to be part of an interdisciplinary cohort, what you would learn from that, what you would contribute to that. We do also have a CV. There is no page limit on the CV. So really take this opportunity to tailor your CV to this application, highlight previous interdisciplinary experiences you've had, highlight ways that you've explored One Health type questions through your CV. So take that opportunity, use your CV as a critical part of your application. And then the final component is a couple things to be submitted from your advisor. We do want a letter of recommendation from your advisor, and this should be a recommendation letter that speaks to your skills and your qualifications. It should also say that they are supportive of you participating in this program and that they understand the requirements. So basically they understand you're going to be taking these courses. They're going to do their best to attend these mixers, that type of thing. And then we do also ask for a copy of your full graduate school application, which your advisor should have access to or be able to get access to. But do make sure you loop in your advisor because they need to submit these by the February 1st deadline as well. And we wanted to let you know kind of what we're looking for in these applications as well. Michael, take us off there.
Thanks. Yeah, so one thing that we learned a lot from our first year is that the fellows or the fellows applications that really distinguish themselves, and again, highly competitive process. We use a very robust rubric. I would compare our process to any process for fellowship selection anywhere in the world as being robust and fair, but highly competitive. And so one thing that is critical to us is that the fellows application meet what the Global One Health Academy is trying to do. And what that often comes down to is seeing in the application the ability of the potential fellow to get outside of their disciplinary focus. This is a challenge for all of us. You know, we are trained in disciplines within academia, but the goal of this program is to see people who can really get outside of their their disciplinary program. And that's mostly done through the articulation of how the research and the personal statement can show that potential. Now, we understand that people are often doing disciplinary research, but the key is, can you think about it in a different way? Do you see potential for your narrowly focused disciplinary research to be broadened into that One Health framework? And in particular, looking at the intersection between these really what are kind of disciplinary foci. So you might focus on animal health as a disciplinary if you're in vet med, for example, but can you see the interactions and the intersections between that and human health and that and ecosystem or plant health? And so it's really about that articulation. Yeah, and we are really open to broad interpretations of this and creative interpretations of this, but the onus is still on the applicant. We also, especially in that personal statement, are looking for students. This is really a training program. So we're looking for students who will benefit from that participation in the training programs and will contribute. So that's something that could come out in your personal statement where you talk about your past history in contributing and benefiting from these kinds of opportunities. It can also come through the advisor letter and the CV for that. Again, I can't emphasize enough the clear articulation, and it has to be um, it has to be done in a way that is going to be obvious to someone not in your discipline, certainly. And so there's quite a bit of importance on, well, frankly, wordsmithing, on making it clear, well written, and and again to a non-expert in your field, but somebody who is already a broad thinker, because they may be coming at the review of your application through the lens of a social scientist or through the lens of an engineer, and so be sure that that is abundantly clear. Okay, I think that's what I think I said what I wanted to say. Meredith,
Yeah, and
anything to add to
just
that? Yeah.
Yeah, I just wanted to really emphasize that last point that Michael said. We do have reviewers from across campus. So when you're writing this proposal, it's a fine balance. It needs to be written in a way that if this were to go to somebody that is in your field, they have enough detail that they can understand your methods, understand why it's an exciting question. But if it goes to somebody that is very outside of your field, they still need to be able to not get lost in the proposal. They need to understand generally what's happening and generally why it's important. They may not need to understand all of the methodological details, but you don't want them reading it and just completely glazing over because it's too in your discipline and too specific. So it's a fine balance between articulating well for what you're doing in your discipline, but also making it accessible to that broad audience. The final thing that I'll say is that through our evaluation rubric, we weight the research component and then kind of the personal components equally. So do not disregard the personal statement as something to throw together last minute. It is really important. We really want to know why you're interested in this program, what you would gain from it, how it might impact your research or your career path. And so do know that those are held equally in the rubric.
One thing I also want to mention that I kind of forgot, and it shouldn't change how you prepare your application, but rest assured that our rubric also includes different levels or different stages of graduate students. So you might think, well, I'm a first year graduate student. How am I going to compete against a fourth year graduate student who already has? And we actually have kind of a sliding rubric that works for all different stages of graduate training. So rest assured, if you're worried about that, that we actually take that into account because we want to recruit across different stages, and we did successfully in our first cohort as well.
Yeah, so that's all the content that we had. So we do want to open up for questions now. Obviously, feel free to connect with the Global One Health Academy, and then this goes to the fellows application. I did get a question in the chat that asked, how detailed does the research statement need to be, considering some of us are at the start of our graduate work and still defining details? And so that goes really nicely with what Michael was just saying. We do have different considerations on the rubric, still the same categories, but different ways to evaluate those categories for an early stage versus a later stage student. So if you're an incoming student, you probably don't have your research very well defined yet, and that's okay. What you'd be writing about there is, what are you interested in? What do you think you might research? How might you approach it? So working with the person that's going to be your academic advisor, and coming up with the details as best you can. But we certainly understand that that's not going to be the same as a fourth year PhD student that's already done a lot of their research and they're doing one final portion. So yes, do the best you can with the abilities you have. For those early stage students, we're looking more at, what are the types of questions you're interested in? How does it fit in that framework? And do you have the start of good ideas and good approaches?
And based upon last year's review of, again, we reviewed 83 applications, so we got a good sample size. Um, Actually, in some ways, I think earlier stage students have a certain advantage in that they're not as inculcated in their discipline, and so they're a little bit broader actually in how they can see where they might head with a One Health aspect of their research. So I actually don't think it's on balance, it may even be a slight advantage to be a little less um, you know, in the discipline. So
Yeah.
yeah,
So I'm going to stop sharing the screen just so we can see each other a little better, and we'll continue opening for questions. Feel free to do the virtual raise hand, and I can call on you, or post in the chat. We can answer them either way.
so there's a question about how this would impact the existing GSSP, which is the support program for graduate students, and um, we pay for everything. So I don't think it necessarily impacts the GSSP, except that the GSSP, as and I should really know this really like the back of my hand as a DGP, but guarantees funding, guarantees tuition support for a certain period of time. Um, I don't, this doesn't give you an added year of GSSP as far as I know. So you're still kind of on those time frames of the GSSP. So it doesn't really change
Yes.
that in that way.
Yes, so I'll just add on a little bit there. That's absolutely correct what Michael said. This is set up as a fellowship, so we are not hiring you, we are not supervising you. You stay as an employee of your department on the GSSP like you have been. If you haven't been on the GSSP, you'll be on the GSSP for this fellowship. Your funding will come through the graduate school, as the graduate student support plan stipends already come to you. Like Michael said, it does not give you an extra year. So those time limits of how long you can be on GSSP, those still apply. If you have exhausted the time you can be on the GSSP and then you're awarded the fellowship through us, I believe we should be able to still fund you, because we're basically giving additional funding. But if you're still in the middle of the time you can be on the GSSP, it stays that time, if that makes sense. I got a message in the chat to please post the link to the fellowship or the professional development. So thank you for reminding me about that. I will post that in just a moment. I did have another question in the chat. What is the application part that has the most weight in the rubric? So the rubric is equal research and equal kind of professional development, personal fit type things. We have different categories within those. So we have, I'm trying to remember, I don't have the rubric in front of me right now, but for like the research side, we have strength of the research just generally. We have strength of the fit with One Health, evidence of prior research success. And again, these are on a sliding scale. So these look different for an early stage student, what evidence of research success looks like versus a late stage student. But I think the main thing to emphasize is the research and the personal are equal. So we are looking for good research, strong research that is One Health oriented and aligned with a Global One Health Academy thematic area. And we are looking for somebody that is really interested and able to articulate well why they're interested in interdisciplinary training, how that's going to be impactful for their research, how it might impact their careers, and why they want to join this program in particular to get that interdisciplinary experience. Another question in the chat, and feel free to share these publicly if you would like, but I can keep reading them if they're direct messages to me. So question is, can I still apply for this fellowship if I am currently on a fellowship, such as the genetics and genomics scholars that will last until summer? Michael, do you want to handle that one so I can post the link to the professional development?
Yeah. Yeah, and absolutely you can. This fellowship actually wouldn't start until fall. Um, we don't offer, well, I mean, it's a year fellowship, but it would start in the fall and then go to the next fall in terms of the stipend. Um, so yeah, absolutely. We had one GG scholar who did GG. Well, it's Jade Lyons. I mean, we already showed her picture, so there's no denying it. So we had one GG scholar who did GG scholar first year, and then this fellowship in her second year. So yeah, that's not a problem at all. Yeah.
Yeah, and I'll also add, I have gotten questions previously about, can I do both this and another fellowship programs? Like if you're selected for like this and also the Global Change Fellows, for example, something like that. You cannot get paid for both of them. And it would be at the discretion of the two programs whether they think that is something that makes sense to do. We don't have a policy against that. So if you were to be selected as a Global Change Fellow and a Global One Health Academy Fellow, you can do both as long as you can do those requirements, but you'd only get paid for one of them. And the Global Change Fellows would have to also be okay with you doing both programs. So just putting that out there as well. Another question in the chat, since this fellowship is new, could each of you talk about one of your favorite moments so far within the program? Michael?
um, I mean, honestly, I think that the one credit seminar course had a lot of really great moments. It's like you're bringing in, and as the instructor, maybe it's a little bit of a different perspective. But I'm sure Meredith has about the same perspective too, because we're kind of both serving in that role in that course. But bringing in these graduate students from different colleges, really different perspectives, um, was really eye-opening. And although probably the one that is kind of most closely aligned to my field, although not exactly, was Jade Lyons. And we started out, we were reading some papers, and she suggested a paper that I found really like revelatory of how plant genetics and genomics can be viewed in a One Health framework. And I thought that was really like a nice moment for me personally to really say, yeah, we're on to something here in terms of how we can pull diverse academic backgrounds into the room at the same time and see these connections. Another good moment for me, one of our fellows works on air pollution, especially indoor air pollution, and including the transition in resource poor environments from using wood-based fuels like charcoal and wood directly for cooking to liquefied natural gas, and I happened to be alerted to an article that showed that in Africa, the use of this, liquefied natural gas for cooking actually increases the attractiveness of a home to mosquitoes. And so that's like, for me, I'm a mosquito person. So that was like a really neat, like, wow, there are these connections out there, waiting for us well, other people are working on them, turns out, because that's our modern scientific world. But, there are a lot of connections out there and we just haven't thought about them very much. So those are some good moments for me personally. And Meredith, you want to add?
Yeah, I agree completely. So this is new. We've been doing it for one semester now, and kind of the bulk of the interactions we've had have been through that seminar course. But it's been wonderful. It was truly the highlight of my week last semester. Bringing these fellows plus an additional students. That seminar is open to graduate students broadly as well. And we did have one person that wasn't a fellow joining the course, which was also great. But having these students bring papers from their discipline, talking about their research, and then just going around the room and saying, how might this type of research relate to your field? And just hearing those connections that those of us in the room hadn't thought of before. And it was so interesting, so fun. And the students, the feedback that I've been getting so far is this has really been wonderful. It's made me think about my research differently. And some of the conversation we've had has led to people saying, oh, that's an easy thing I can add on to my existing research. And so it is actually starting to kind of shape the way people are approaching their research. For example, the question Michael was talking about indoor air pollution and mosquitoes being attracted to that. One of the recommendations with indoor air pollution, if you're using those wood-based cooking fuels, is to ventilate well. But then when you open your windows in those low resource settings, there aren't always screens, and that tends to be in areas where there's a lot of mosquitoes and a lot of mosquito-borne diseases. And so it's very easy to add in a variable about when you're already measuring health outcomes, like add in, are they also getting more malaria if they're using these wood-based fuels? So yeah, that's been fun for me. Another question in the chat. So just to be clear on expectations around how connected your research is to the thematic areas. For example, if my research is related to climate and land use change, but not necessarily health disparities, would it still be appropriate to apply as long as I can articulate how the research could be applied in a health context? Yes, absolutely. You don't have to do climate change and health disparities. That is just, we have a broad theme that includes both climate change and health disparities. So anything related to climate and land use, anything related to how those things affect different populations differentially. Basically, as long as you can argue my research is related to food and water solutions, infectious diseases, or climate change and health disparities, something in that bucket, and you can articulate how your research touches at least a couple of these different health systems, humans, animals, plants, environment, biodiversity, then it is a good fit for this proposal. You do have to have both of those things. How does it fit with a thematic area? How is it One Health? But as long as you have that, yes.
Yeah, and I would say, to be clear, like, we understand, we're already all in disciplines, and that's what we do. So I think it's perfectly understandable that, you don't have a chapter of your dissertation already, or your thesis is going to be about those connections. So it's perfectly appropriate to be like, here's what I do, and here's how I could see what I do connecting to these things. You don't have to say, I am doing this, right? Because, if you're already doing it, what do we need this Global One Health Academy for, right? The point is to shift your perspective in the fellowship training. So, but what we'd like to see is that you already see that potential there, because we're not disciplinary experts in your discipline. So you have to kind of already see that creative connection that can be made and articulate it, but it doesn't mean you have to be doing it already, if that makes any
Yeah.
sense.
Yeah,
So,
that's one of the things we really hope to do with the program, and that's why we want to offer these interdisciplinary interdisciplinary kind of co-mentorship opportunities. So we can't force you to meet with a different faculty member, but if you're articulating, I study this thing in particular, and it's not necessarily interdisciplinary or engaging with the other health domains, but you see how it could, and you need help with finding a collaborator that can bring you into the animal health space, we want to be able to provide that opportunity for you. We want to see growth during the fellowship. That's why in the call we say that first and second year students would be ideal candidates, but it's open to everyone. And like Michael emphasized, our rubric does not bias against or for early stage or late stage. The only reason we say early stage is ideal is because then if you see these connections, if you're meeting with different faculty members and you want to kind of add something to your research that does make it more One Health and more interdisciplinary, you have the time to do that, versus if you're late stage and already have your committee set and your research is almost done, you likely won't be able to do that. But again, still open to late stage. And we have a handful of late stage students in our current cohort. They've been wonderful. And I think it's still been really beneficial for them in shaping kind of how they might approach research on the next step for them. So their postdoc or their faculty careers.
And I'll give a quick example, and this is not a real example. This is one that I've kind of played with in my head. But, suppose you have somebody who's a wheat breeder, and, their interest is in making wheat that is more drought tolerant, right? And you may think like, okay, that's good. I mean, yeah, there's some food security, angle that they could take. But we could also think about irrigated agriculture as a source, and this is personal to me, as a source of vectors of West Nile virus in the Great Plains states of the in the U.S. And so by thinking about how making wheat less reliant on irrigated agriculture versus is that then you could reduce the risk of West Nile virus by not providing habitat for mosquito. Now the wheat breeder student isn't going to know all that stuff about mosquitoes. But if they just say like, hey, is there a connection here? And they were to link up with a medical entomologist like myself, then we can make those connections. And so those are the kinds of things. It's just one, fairly specific example, but, think creatively about it. I did get a question about the number of fellows. We have 5 guaranteed slots for next year. There is the possibility that there could be slightly more than 5, depending a little bit on funding, but at this point we can only be sure that we have 5 slots. That's right, Meredith, right? I believe that's
Yes, we definitely have 5. There may be slightly more depending on our funding situation, but we will have at least 5. I do expect it to be competitive like it was last year, and I say that not to discourage people, but actually more to encourage. If you applied last year and you didn't get it, that doesn't mean it was a bad proposal. It was just extremely competitive, and we had a lot of wonderful applicants that we wish we could have funded. So if you are somebody that applied last time and didn't get it, please reapply. Yes.
Yeah, I wouldn't say it was like super
Go ahead.
argumentative or contentious in our reviews or anything, but there were a lot of really good candidates, and yeah, and I mean, probably the top 20 were relatively close, so.
Yeah, and there was another question in the chat. How many applications did you have in the first edition? So we had 83 applications, and this was from 8 colleges across the campus, so 8 out of the 10 colleges. So it was very competitive, and like I said, a lot of those applications were strong, and a good number of them were very strong. And we wish we could have funded them. So last time we did not have any applications from the College of Education and the Poole College of Management. So we want to again emphasize that this is open to researchers from all disciplines. Any type of research is welcome as long as it is reasonably a fit with One Health. So for example, one of our fellows studies communication and rhetoric of health. So like how we talk about health in the news. But she was able to articulate how that's relevant to the One Health context, and how she was doing a project that was very much a One Health project about how we communicate. So we do welcome and encourage applications from all colleges. I'm not seeing any others in the chat. Oh, are you planning to open calls for students to participate in events like the travel award? So we do have a travel award, and that's open to all graduate students. The applications have closed for this semester, but we do anticipate doing calls for that again. We have 2 calls per year, one that comes out in the spring for late summer and fall travel, and one that comes out in the fall for spring and early summer travels. So best way to stay in the loop about those is to be on our listserv or follow us on our LinkedIn. So we always share information about that. If you were asking something else, feel free to let me know if I misinterpreted something.
Well, and I would say that we will have on-campus events too that fellows certainly would be a part of. We have not earmarked fellows travel money, for example. That's a separate competition, but fellows, some of our fellows have gotten travel awards as well as we're fellows of this cohort. So certainly that doesn't affect it one way or the other.
Yes. Any other questions? We are happy to continue answering questions, and also happy to answer questions over email if you think of things that you didn't ask, but that come up afterwards. You could reach out to myself or Michael, and we're happy to answer questions. But happy to stay on and answer other questions if people have them. All right, well, seeing none right now, I do want to be respectful of people's time. We're ending a little bit early, so we can get a little bit of our time back today. But thank you all so much for coming out to learn more about this program. We're really looking forward to receiving your applications. And like I said, do feel free to reach out to myself or Michael with any questions you might have. I'll post our emails in the chat really quickly. That one is mine, and this one is Michael's, so do feel free to reach out to us. And also connect with the Global One Health Academy. We would love to see you at our events and engage with you in other ways as well. Have a great rest of the day, and we look forward to receiving your applications. Bye, everyone.
Thank you so much.
Thank you.
You're welcome.
Have a great day.
Thank
Thanks.
you.